County. Again, we lost 6 people, 6 too many, but for crying out loud, it's one whale of a lot better than sitting here reading 80 great West Virginians that we've lost or more. So please, I ask for your prayers for all these great people. I ask for your prayers for all their loved ones, and I ask for your prayers for West Virginians. We've had 421 cases of positive cases in the last 24 hours. The positivity rating is still 3.99, a little less than 4, and that's still good. Our cumulative percent positive cases continue to drop. Now we're at 5.48. That number won't go that quickly, but if we just keep at it, we're just going to whack at it until we get it on down. Our active cases in West Virginia are below 8,000. They're at 7,800. That's fantastic, you know, compared to absolutely to where we've been. That's 41 straight days in West Virginia that number has dropped. Our recovered cases now are at 121,143. Fantastic. We have 267 people hospitalized and 62 in the ICU units, and we have no red counties in the state of West Virginia. All good. Again, I remind you, if you're 65 years of age and you have any kind of health condition that is worrying you, that is different, please go get a test. I mean, we can save your life with these antibodies if we catch it early enough. Please go get a test. Remember, these antibodies are here. If by chance you'd have a doctor that would say, no, you don't need that and everything, and you have a positive test, absolutely insist on it, and if you holler loud enough, somebody will hear you and will get you the antibodies. You know, I just said earlier that we've been stocking trout. This morning I announced that my spring trout stocking initiative is now underway all across West Virginia. We held the first ceremonial trout stocking event of the spring in Logan County this morning at Buffalo Creek near Man. I was joined there by Steve McDaniel and our Secretary of our DEP, Harold Ward, was there as well, and the Buffalo Creek Watershed Association, and those men were doing phenomenal work, and we had the county commissioners there. Just a lot of excitement down there. That stream looks fabulous beyond belief. There's been a lot of, you know, upgrades to the stream, surely picking up trash, but a lot of things to speed up the water, put more oxygen in the water, you know, just things that absolutely will make the habitat for trout just that much better. In West Virginia, we are planning to stock 1.2 million fish statewide, and we are also, in this year, we're adding fingerling rainbow trout stockings as well, and that will ensure that our streams will be fishable from the standpoint we hope are fishable year-round. So that just makes things even better and better and better for all of our anglers. Many of the successes we are experiencing in our trout program are a direct result to a $30 million spend that we've put into place into our hatchery renovations since we came into office, and so all that's good stuff. 2 years ago, I directed the DNR to improve our trout stocking methods by spreading the fish out. This idea of just rolling up to a hole of water and dumping the fish in 4 or 5 holes, or even maybe less than that, that doesn't do anything for us, because almost before you turn around, the fish are gone. People are standing there throwing lines over top of one another and everything. We have an initiative in place to where we have 2 trucks that follow the stock trucks, and in each truck are 4 guys. Sometimes it's a little less than that, but 4 guys, and absolutely they carry the fish up and down the stream and absolutely put the population of fish all over the stream so the fish last, and it gives us a great fishery for many, many days to come. It seems like a simple solution, but we just never did do it before. And now we're really, really getting good, solid accolades for doing it the right way. We did have several free days of fishing and other promotions through the past year to encourage people to get outside, cast a line, and make some real memories, real memories. I tell all West Virginians to get out this spring and enjoy our world-class fishing opportunities and unmatched, I mean, there's no question about this, unmatched beauty. We're blessed beyond belief in this state, and just great, great, great stuff going on. And I couldn't be more proud and more thankful to all those working in our hatcheries and you know, Steve McDaniel and all the great work he's doing. It's really, really, we are moving the needle, and that's really good. And I want to thank our DEP for the great work that they did down on Buffalo Creek, and we want to keep on doing that kind of work all over the place as well. Also, I had the opportunity and the honor beyond belief to lay a wreath at the memorial of the Buffalo Creek disaster. And I was joined with a beautiful lady today that assisted me in doing that. And you know, I just keep going back and thinking, you know, that in 1972, 49 years ago, on a kind of dreary February day, you know, a coal slurry dam collapsed and unleashed 132 million gallons of black wastewater, you know, on several towns along Buffalo Creek. 125 great West Virginians died, another 1,100 were injured, and 4,000 were left homeless. You know, even though it's surely been 49 years, I remember it like it was yesterday. What a catastrophe. And what a rebirth of that stream and that community. And they need so much more. You know, southern West Virginia, of all places, is so beautiful. Its mountains are a little more steep than those of northern West Virginia or the eastern panhandle. Absolutely, its streams are pristine beyond belief. You know, the beauty is phenomenal, but yet we still have not had the people come. There's still too many people in southern West Virginia that are really hurting, and we need to try to find any and every way we possibly can to amp up tourism, to amp up manufacturing possibilities down there. There's so many, many things when you've got an abundance of water. You've got absolutely rail service. You have got so many things that are there that would drive people to West Virginia, but we've not solved the riddle. Absolutely, I believe, and I'm not going to go into promoting this here, but I believe that absolutely the thing that would turn the dial and turn it tomorrow is the absolute repeal and getting rid of our state income tax. If we do that, I think you'll see the rebirth of our entire state, but I think that's the ticket for southern West Virginia. But like I said, I won't get into that now, but I absolutely believe that that is right there for the making. Last Friday, I announced several restrictions that we were lessening, and they're on small businesses and schools and our public gatherings. They're all up on my website. It's still absolutely mandatory to have a face covering in all public buildings, and so all that's up there. Please follow those guidelines. It's really important. You know, this week's allocation, we're now up to 90.1% of the administration rate for first and second round doses. You know, we still continue to lead the nation, and by the end of the weekend, we'll have them all out again. Our goal is always 100%. All that's good stuff. We have now, in the arms of West Virginians, 469,191 doses. That's first round and second round combined, but we're getting it done. And you know, hats off again to all the communities and the health clinics and all the health officials and the DHHR, National Guard, all those that are making this a reality, and we thank them beyond belief. As we continue to lead the nation over and over and over, you know, it's just amazing. And I My hats off to great work. The Johnson & Johnson vaccine is right around the corner from us. On Wednesday, the FDA released an analysis of the Johnson & Johnson's COVID vaccine that supports its authorization for emergency use. Today, a panel is scheduled to meet to evaluate the vaccine and make a recommendation whether or not it should be given authorization. If the FDA authorizes the Johnson & Johnson vaccine, we anticipate receiving approximately 15,000 doses, additional doses, to the doses that we are already receiving from Pfizer and Moderna. And our first shipment should be next week. The great part about this vaccine is it does not have to be stored at this, incredibly low temperature, and from the standpoint also that when, it's just a one-shot vaccine. That's the upside. If this comes to pass, next week, our total doses in West Virginia should approach 60,000. That's great news, and we're ready for it. So send them on. Just keep sending them. Our vaccine scheduling system is up. We need you to pre-register. I ask again, in the counties of Mercer, Mingo, Wayne, Mason, Jackson, Monongahela, Mineral, Morgan, Berkeley, and Jefferson County, you're behind. You're behind. We need you to pre-register. And were you saying something, Jordan? Okay. So just get online and please pre-register. We've now pre-registered 297,000 West Virginians. We need that to be 600,000. So just keep at it, please, West Virginia. Get pre-registered. And if you can't, and you don't know how to do it and everything, just call us, and we'll walk you through it. As far as our Saving Our Wisdom clinics and everything, they're in all 55 counties. We don't have enough doses to completely go around, but at the same time, if you'll get registered and everything, and we're cleaning up the wait list and all that, and it'll just only facilitate and help you to be able to get that shot, and hopefully this miracle vaccine will ensure and take away the possibility of you ended up with COVID and even worse, ended up being one of our casualties. I always read this number because this number really is a gigantic number to me. We have now put shots in arms of 160,939 of the people 65 years of age and older. And we have second round shots that approach right at 90,000. Now let's just step back and be fair again, and be brutally fair. These folks did not think that they would ever get their first shot before probably the end of March or early April. Well, it's February the 26th, I think. And 160,939 have been vaccinated. Now, I would tell all those out there that are 65 years of age, how many of this 160,939 have had real bad problems? I'll tell you, if it be any, it is absolutely very, very few. If you haven't gotten your vaccine, you've got to do it. That's all there is to it. You have to do it. If you're 65 years of age and older and you don't do it, you're just asking for it. You're just asking for this thing to jump right on you. And when it does, it's tough stuff. So absolutely, please get your vaccine. Our vaccine hotline or info line is up there and everything. It tells you all the different stuff and, where we're at and all that kind of stuff. So watch that. There's no point in me reading and going back through that. Vaccine reminders, please just get your vaccine. We're not going to sit around and worry about the sky falling or you growing antlers or something like that. So the crazy stuff that people put in people's heads and everything. Just get your vaccine. It absolutely is perfectly safe, and you'll be just fine, and absolutely it'll protect you and save your life. All of our testing maps up there. I encourage you to take advantage of the free testing. The drive-through pharmacy people, Frith and Walgreens, have done phenomenal work. We thank them over and over. Get this now. Our long-term care facilities. You know how many outbreaks we have in long-term care facilities today? 9. There's got to be a reason, doesn't there? There has to be a reason. Well, the reason is just plain simple. You know, if you go back in time a couple of months ago, you go back 6 months before that or whenever, how many times did I sit and tell you that we've got to bridge ourselves to the vaccine? I told you that over and over and over. We have to buy ourselves enough time to get the vaccine. And the vaccine will take this killer away from us. Now, I can't guarantee anything. I can't guarantee that a variant won't come and cause us more problems, but I can tell you just absolutely just this. And here's all there is to it. We have 9 outbreaks today in our long-term care facilities. The answer as to why is absolutely just one thing. We have shots in people's arms. We've stopped the chain. That's absolutely what is going on. You've got to get your vaccine. We have 1 outbreak in our church community. It's in Webster County. We're happy to get Fayette County out of that. You know, I strongly encourage you just to keep on doing what you're doing in our church community, and I'm really proud of you. Keep that pew in between you, and absolutely the social distancing, and wear a mask. And you know, and if you're elderly, you can get your services online right now. We're close. We're close. Just hang in there and let's get across the finish line. Corrections, we have 37 inmate cases today and 15 staff cases. This kind of bounces around a little bit. We've got 28 inmate cases that are at Southern Regional. You know, we've seen it over and over. When we get one place like this, you know, then it kind of heats up and our people continue to run to the fire, and they're going to extinguish this fire as well. I tell you over and over about wearing your face mask. It is absolutely your first defense other than your COVID vaccine. And even if you've got your COVID vaccines today, I highly, highly, highly still encourage you to wear your face mask, protect yourself and protect others. And the last thing I've got on my list today is give blood. You know, really and truly, it's a requirement in lots of ways. It's a requirement that God above gave you the blessing beyond belief for you to get well. If you're able to give blood and you've had COVID, I absolutely urge you beyond belief to go do that. Go do that. You'll save a life. And absolutely, I can't tell you enough, what's it worth? What's it worth to save a life? We'll never be able to measure that, will we? But absolutely, it's worth more than is ever measurable. So that's all I got. Thanks a bunch. Sorry for the dress, but you know, we've been doing some good stuff in Buffalo Creek, and keep all those people in your thoughts and prayers down there as well.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. As the Governor pointed out, we continue to make good progress with our vaccination efforts. Over 42% of our age 65 population has now had at least 1 dose of the vaccine, which we know is exceptionally important. Some key highlights, as the Governor pointed out, if the EUA is approved today, we believe sometime potentially late next week, we could receive as many as 15,500 Johnson & Johnson doses. So that will be important to us moving forward. And we will continue to focus those doses, as the Governor has said, on those populations that we know are the most vulnerable. In addition to that, we are today sent in the notice to the federal pharmacy program that we were given an option to add 1 more block to that, and we will be adding the independent pharmacies to that block. So that will give us probably the following week additional doses in a number of different independent pharmacies across our state, which will be important to our community-based approach in the 55 counties. We continue to press and improve our processes where we go. As the governor pointed out, to only have the number of names and announced today is incredible progress for us, but not where we need to be. But along with that and the only 237 people we have in the hospitals as of today, we know getting a vaccine is making exceptional progress for our state. So we encourage everyone to continue to identify friends, neighbors, relatives, and go out on your own if you haven't and register so that we can get to you and get a vaccine to you. Last thing I leave you with, we want to thank the Kanawha Charleston Health Department and all the participating agencies that supported the clinic yesterday for our veterans. And we had a 92-year-old World War II veteran. We had veterans who have been unfortunately become amputees. A lot of veterans got great opportunity and advantage yesterday, and we greatly appreciate the work of everyone involved to take care of our veterans. Thank you.
All right, thank you, sir. Also joining us today are Secretary Bill Crouch with the DHHR and Dr. Ayn Amjad, our State Health Officer. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. It's Kenny Bass from Channel 8 and Fox 11. I have a couple of things very quickly, kind of cleaning up for the week. One is for General Hoyer. Some calls that people received their telephone invitation to get a vaccination at a Walgreens today. They went to the Walgreens, but they, along with 4 or 5 other people, were told once they arrived that, and they had a confirmation, by the way, they arrived, it said that there was no vaccine for them. So I'm wondering if this reaches back to, you mentioned a glitch or something earlier in the week with the system between Walgreens and the state, if that's an ongoing problem or if this is a single specific event that's not connected to anything. And finally, I guess for Dr. Amjad, perhaps the governor might want to weigh on this too, because he always talks about the effects of the vaccine. On the CDC website, it's been brought to my attention by several people, actually, that of the 63 million doses of the COVID vaccine, which has been administered from December 14th through last week, the CDC has received reports of 1,099 deaths among people who received that vaccine. It's a very low number statistically, and also it says a review of the available clinical information, including death certificates, autopsy, and medical records, revealed no evidence that vaccination contributed to patient deaths. Sorry it's getting so long, but here's the bottom line. Governor, people see that number, and even though there's no confirmation the vaccine is related, they still get concerned and scared, and some people don't want to get the vaccine because of that. Can you allay their fears and talk about the statistical really insignificance of 1,100 deaths with 63 million doses? It comes to 0.0015. Thank you.
Well, Kenny, let me just do them both, and I think I can do both of these. First of all, the Walgreens thing was just hopefully a one-off deal, but just a Walgreens kind of mess up and everything. I don't even know how to explain it any better than just that. Just again, I think that was just some kind of failure on the Walgreens side, but I'm sure that'll get fixed, and we're already all over that and everything. So I think all that's fine. We hate to have any mistake, but listen, along this way, we just love all the great work that Walgreens has done, and everybody's going to screw up some little something, and so we'll make that right. And the other thing, as far as the people, I haven't seen, Kenny, what you're talking about there, but I think we've got to continue to pass everything off to the medical experts that are all across this land. Now, let's just think about this just a second. Let's put it in these kind of terms. 60 million equals about it's a little less than 1/6, or let's just say it's 1/6 of the entire population. In fact, it's not, it's not quite, but but it's right at 1/6 of the entire population of this entire country. Now, so we've lost 1,000 people out of 1/6 of the entire country population. Now, how many people do you think in our country die every day? They just die. They die of something. That's all there is to it. Now, if what we have done is we have vaccinated 60 million people, and we've lost a little over 1,000, the chances of you literally going out and getting in your automobile are multiple of times higher at risk than they would be taking a vaccine. In fact, if Kenny, your number I think was 0.00 something, and if that's the number, you may be safer taking the vaccine than you would be to stand out in your yard and maybe have the possibility of a meteorite hitting you. And I'm only exaggerating to make my point. The reality is just this: the numbers do tell us the truth, don't they? If you vaccinate 60 million people, or let's just say you pat on the head 60 million people, some of those people are going to die. That's all there is to it. So if we go by every one of those people, we just pat them on the head, and then we wait 2 months, we're going to find out that some of the people we patted on the head are not any longer with us. Now, so I can tell you this, and I can strongly tell you this: follow the math, listen to the experts, don't get scared. I mean, for crying out loud, please don't get scared, and don't listen to hype that drives you to decisions that are not good decisions. That's all I've got to say.
All right, thank you, Kenny. Next to Charles Young with WV News.
Minority community vaccination clinics we talked about a month ago. I know we discussed the process of setting all that up, but I hadn't really heard anything since that. And then I was also hoping at a future press briefing, would it be possible to include Reverend Patterson again to have us get some more on the ground information? Thank you.
Okay, I didn't get the first part of the question, but I hope Dr. Amjad and Secretary Krause got it. But if y'all could answer Charles, that'd be really good.
Yeah, this is Bill, Governor. I did not get the first part of that question either.
I'm sorry, I can repeat myself. I was just wanting an update on our minority community vaccination clinics that we talked about at the end of January.
Yeah, thank you, Charles. Good question. We're focused on trying to get more African Americans vaccinated at this point. We, in fact, changed the priority last week so that when lists get pushed down to counties, those county lists include first and foremost African American and minority populations age 65 and over, then individuals age 80 and over, 70 and over, 65 and over, et cetera. So there are issues with, and as the governor said, talked a minute about the Walgreens. We hope those are few and far between, but we're registering across the state 40,000 people a week, and we're going to have little glitches here and there. But the African American population, and Reverend Patterson is really focused on getting out throughout the state and getting as many individuals registered as possible. This is a good time to say that we only have 0.2% of African Americans registered in Everbridge, in the state vaccine registration system. So we really need folks to register, to get online, or to call our call-in line, the vaccine call-in line, to assist you in getting registered. So everyone out there needs to register, but we're really trying to get more African Americans to register as well. We're also looking at other contracts. We're hoping to get other folks involved in trying to get to that population. So good question. Thank you, Charles.
All right, thank you, Charles. Next, we'll go to Mark Curtis with the Nexstar Media.
Good afternoon, Governor and cabinet members and fellow media folks. First, to comment, many of us in the media are getting notified today that we're going to get our first shots this weekend, and we appreciate that. I mention it because last year when the pandemic began, we were designated by the U.S. Department of Homeland Security as emergency communication workers, therefore essential that we go to work. And obviously, we've been in perilous situations like many of you. And so we appreciate Governor and General Hoyer and everyone else to the extent that you're getting us vaccinated now is much appreciated. My question is for General Hoyer, anyone else can weigh in if they wish. Will the Johnson & Johnson vaccine be distributed in a different way than the Pfizer or the Moderna because it only involves one shot? Will you target groups of people like those 65 plus or the homebound that may have a difficult time getting shots on two different dates and making it easier for them to just get vaccinated in a one-shot deal? Or are you going to implement it the same way you've implemented the other two vaccines?
General, before you go, let me just say this, Mark. I'm tickled to death that we're getting those shots to the press and everything. You guys are essential, and you're out there every day, and so I'm tickled to death we're getting that done, and hopefully that'll go real smooth and real quickly. But General, please go ahead and answer the question.
Yes, sir. Thank you, Governor. Mark, in our discussions with the governor, we believe that we know from our data that we still need to focus on that 60 to 65 and older population, our essential workers age 50 and above, and continue to provide those maintenance doses to our nursing homes and to those incoming staff members in hospital facilities. We know that this is working. So I believe right now our intent is to continue to move forward with the Johnson & Johnson vaccines focused on those populations, but it will allow us some flexibility. For example, older individuals who may not be as mobile, who would be easier to get a single shot to, or certain populations like that. So that will be our primary focus area as of now.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good afternoon, panel.
I'm sorry, Paul. I don't think your connection is good enough for us to hear you, so we'll have to come back. Let's go now to Aaron Williams with WBOY.
Hello, Governor. Following up on one of Kenny's questions from earlier about the Walgreens glitch. I know you said it was just a small glitch. Here at our station alone, just in the last day or two, we've had half dozen people or more who've been affected by that. I know earlier in the week it was characterized as an issue on the state's end, and I know you just said it was something with Walgreens. And now, could we get a little bit of a clarification on that and maybe some explanation of what's being done to fix that? Thank you.
Well, I understand, from my standpoint, I've heard about it. I don't know all the specifics. I know that there was a corporate list, or the Walgreens corporate made a mistake on the list and sent the wrong list or whatever. I just think that at the end of the day, I don't want to take anything away from the greatness of what Walgreens has already been doing, and I truly expect as we go along that there has to be a mistake here and there. I don't want to make light of it from the standpoint that, whether it be 3 or 4 or 5 or 6 or whatever it is, I mean, those people that went there and then, spent their time and they went there and then they're told, that they can't be given a shot and everything. I mean, that's not good. It's just not good at all. We don't want that to happen anywhere. But I know we're on it. Maybe somebody on the team could weigh in and be more descriptive about what we're doing to try to prevent that from happening.
Governor, I can speak. Want me to speak to that a little bit? I do know we've received several calls along those lines, and I was also on a call this morning. So we're working out those logistics, as the governor mentioned. It's difficult when we have several systems in place, but we also heard several good stories as well. There are several Walgreens partners out there who did hold doses for people who did show up. We had someone who showed up at a vaccination site because they got 2 calls on their phones, but then Walgreens ended up holding her dose for her. So while we go through these motions of trying to reconcile, our sign-up system, the VAM system, and the Walgreens partnerships, which we do appreciate, I think we're going to have these communications, but hopefully in the next couple of days, we don't have it. But we also know that we have some good people out there who are holding doses if they have some glitches in the system and so forth. But we expect these things, and we hope that our state partners and our citizens can be patient with us. Thank you.
Yeah, Governor, this is Bill. If I could quickly let everyone know, please call the toll-free line if you have a problem. We have a system in place to try to track every one of those issues down and make sure everyone gets their vaccine. So we'll run every one of those down and figure out what to do to help folks when there is a glitch. Thank you.
All right, thank you, Aaron. Next to Mark Cram with WDVM.
Well, good afternoon, Governor. Good afternoon, everyone. First of all, congratulations. You not only have no red on the state, but there's only 7 counties that are orange. So incredible progress. With the release of the Johnson & Johnson, obviously the one shot is going to really step up the efforts to dispense this. I've heard some questions, especially from some older residents, questioning, is this shot stronger? How is it that they can do it with 1 where the others are requiring 2? Is there greater concern, or should there be greater concern, that there would be side effects or reactions from the Johnson & Johnson shot, whereas not so with the other 2? Thank you.
Well, thank you so much about the great comment about only having 7 orange counties. It's really odd. I was just sitting here and I was counting the counties just a second ago and everything, and looking at the map, and we want more and more and more green, and we don't want to see that red pop up there. But 7 orange is not too bad, and we're just going to keep on working to eliminate those. But Dr. Amjad, you've got to take the question about Johnson & Johnson and the strength and everything. So please do.
Sure. I'll try to make it not too lengthy, but to compare the 2 vaccines is difficult. It's like apples and oranges. So if we want to compare Pfizer and the Johnson & Johnson vaccine, Pfizer was made out of an mRNA vaccine. So when they first made it, they made it as a 2-dose series vaccine. And then you have the Johnson & Johnson or the J&J vaccine, and it's a vector vaccine, or they made it out of an adenovirus, which is another way of making a vaccine. So they're made in 2 different ways, and so that's one difference between the 2. People hear a lot about percentages. Pfizer and Moderna came out strongly and said these are 95, 96% effective vaccines. I want people to keep in mind the normal flu vaccine is a 60 to 70% effective vaccine. So, and that's acceptable. Those are FDA approved vaccines for the public. So, when we heard of Pfizer, Moderna coming out 96% effective, those are great numbers. We love to hear it. The Johnson & Johnson vaccine, the way they've designed it, it's a single shot vaccine. They're touting, 86% effectiveness, which is also good. We want to also keep in mind, like I've stated, these are FDA approved once they come out, which means they are great vaccines. They work, they're acceptable. There's no comparing apples and oranges, how something is designed. Just as you can have 2 brands of a car, you can have 2 brands of a vaccine. We are going to have 3 good vaccines available, which has been made in less than a year for us. So that's what my advice would be to people, that we have the vaccine coming. They're just made differently, but they're both effective vaccines. So that's a short summary of it. We can go into more details probably at some other time. Thanks.
All right, thank you, Mark. Next, we'll go to Ben Conley with the Dominion Post.
Good afternoon. This question is for General Hoyer. The Montague County Health Department learned this week that it was going to get its Pfizer vaccine allocation cut back, so those doses could be diverted to counties that had kind of fallen off the pace in vaccinating those that are 65 and older. Can you just give some explanation as to why the state would divert doses away from effective distribution sites? And secondly, has the state ensured the counties receiving those additional doses can handle the increase?
General, go, please.
Yes, number one, we now have 55 county systems that we believe can do that. Why are we balancing the load? Let's go back to just 6 names that the governor announced today, and that 72% reduction in loss of life that we've had in the first 6 weeks. We know we have 28 counties that have an imbalance, and we have a number of people over the age of 65 in those counties that we must get vaccines to. We knew this was going to happen in the beginning because we had population centers like Mon County, Kanawha County, that had large hospital systems, a number of nursing homes and assisted living more than other locations. And we knew once we got the 55 county systems built in place, that would allow us to better effectively carry out the governor's initiative of Save Our Wisdom and go after those populations. Our interagency task force has to support all 55 counties in the state of West Virginia, not just a couple. Thank you.
All right, thank you, Ben. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Hello. This is going to be directed for Major General Hoyer as well, and really it's following off of Ben's comment. Yes, I mean, could we learn a little bit more about how the state is looking to support these counties that have not gotten a lot of vaccines? So you're saying you're very committed to even diverting some doses to these smaller counties that need to get their percentage of 65 and older vaccinated. But I've been hearing that, you know, some of these smaller counties, their health departments are very small. They don't have a lot of capacity for maybe administering a lot of vaccines, as well as reaching out to their community to make sure that they are registered. And we keep hearing from you guys that these certain counties need to get their folks registered as well. So what kind of support, other than just an increase in vaccine doses, which they're very appreciative of, I'm sure, but besides the doses, how can the state maybe support them administering and registering these people?
General, go.
Yes, sir. Thank you, Governor. So each county now has a county capability that's built. They're different in each county based on the various factors in those counties: size, road systems, all those things. They're made up of emergency management, local health department, federally qualified health clinics. If there's a small critical care access or critical access hospital, volunteer organizations where they need to be augmented with additional support from FEMA reservists and National Guard. That's done. I go back to look at the numbers each week and the track record of West Virginia in getting shots in arms. We're clearly providing the level of support at the local level that we need to get the shots in the arms. And we also now, with the federal pharmacy program and it continuing to expand, and federally qualified health clinics being able to receive doses. The federally qualified health clinics have been a great asset to us in our small rural counties to make sure that this work gets done as well. Thank you.
All right, thank you, June. Next, we'll go to Mason Horodisky with WVVA.
Hi, Governor Justice. I figured you might have an interesting perspective on this as both a governor and a coach. We're getting closer and closer to having the vaccine accessible to the general population, but have you considered athletes, coaches, or any athletic personnel to maybe get that vaccine earlier than some? And if so, what phase might that be in?
Well, the biggest majority of our coaches are teachers, and so I hope that that a tremendous amount of them have already had their shots, but I know it's age 50 and above. And we have said over and over, as we get more doses, we want to swing back and get those people that are 50 and under, and as well as our officials, that we have that are going to be officiating the games. Now, just to be perfectly honest, for the officials that do a good job, I would highly recommend that they get their shots earlier. And for the officials that do a bad job, I'm just teasing. But that's coming from a coach, But nevertheless, we do have a great many officials that are above the age of 50, and I just got to know. Let me just say. From the standpoint of the federal guidance that the kids, as far as the kids go, that are under the age of 16, there's guidance out, there's not guidance out, as far as giving them, the shots at this point in time. So the long and the short of it is, I believe that we should circle back and get the teachers and service personnel 50 and under as quickly as we possibly can, and I will assure you that everybody's dialed into that. The next thing is kids under the age of 16, we don't have any guidance to be able to give them shots as of yet. We need to be concerned about our officials, and we need to be concerned, about limitations as far as people coming to the games, and and how we're going to do that, how they're going to be spread out and socially distanced and all that. But I've been able to be with my kids a good little bit and everything, and I think it's moving, and I think it's moving in the right direction. But we're going to try to stay on it and keep on doing better. That's what we got to do.
All right, thank you, Mason. Next to Janae Dill with the AP.
Hi, Governor. I wanted to get your stance on the congressional COVID relief package, what your latest opinion on that is, and it looks like the $15 minimum wage might not make it from the Senate, out of the Senate. Do you have any thoughts on that as well? Thank you.
Well, I don't really, I haven't looked, I haven't had the opportunity to read and look at the bill at all. But let me just go back to what I've said earlier. First of all, I would say, let me do the tail end of the question first. There are many, many states across this nation, really and truly, that it may just not fit from the, moving the federal minimum wage to $15, because the standard of living and all kinds of things in certain states are so significantly less than they would be in, per se, in New York City or Los Angeles or wherever it may be. And so it's really, really hard to say one size fits all the way across this nation. And we haven't done that. We've not done that in a lot of situations. So I think probably the Senate is doing the right thing in regard to the minimum wage, but we all want people to make more money. We absolutely want opportunity for all of our folks, and to be able to be making it on $7 or $8 an hour, that's really, really, really tough. And so I'm an advocate of more dollars in the pocket of all of our people and everything, but at the same time, I am also smart enough to know that some businesses that would rip apart, it would raise unemployment in some areas, and so we really need to be aware of all those different things. Now as far as how we're going forward with the balance of your question, the balance of your question was in regard to the stimulus, and let me just slip back and just say this about that. I've run a lot of businesses. I mean, a bunch of them. And I've run businesses that were really having a tough go of it from time to time. I've taken over situations, the most visible one, the Greenbrier, bankrupt, and in a real mess and everything. Well, we could have gone in there with 3 rolls of duct tape and tried to put it together, and maybe it would have come back and maybe it wouldn't. We didn't do that. We went in there with an aggressive program that basically where we spent real dollars and we made real commitment to the people. I mean, if you'll go back and look, and you'll be really fair, I called all the union officials to me within minutes of when within minutes of when it was announced that I had bought this. And I said, I want to restore, for all practical purposes, all of the benefits that you've lost in the negotiations that have been going on for a year and everything. And I want us to reward our people and get our people really going. Well, those people took off and everything. And absolutely, you know, everything began to really happen. We put real dollars in the Greenbrier from the standpoint of tennis facility, you know, the chapel, the casino, the sports complex, all the different things. And lo and behold, off we went. And the Greenbrier is doing really well. Now, I'm a real believer if you could use the same concept of this nation. We have tried to underspend and undersize what was really needed to get us over the top of the mountain and get us really going. And you got a lot of people across this nation that are really hurting, don't we? And an awful lot of Republicans are saying, you know, we don't want to do this and we don't want to do that. Now, I am first and foremost, I want you to understand and hear me, I am first and foremost not in favor of bailing out a bunch of pension plans all across this land that were mismanaged for decades and everything. I'm not for that at all. But I am absolutely for the people that are at home and they're struggling to pay their power bill and they're struggling to pay their rent and their car payment. And I am really for all those businesses that are out there that are really hurting and don't know where to turn and have gone and borrowed their last dime that they could possibly borrow to some way, somehow keep the doors open. And in both cases, this wasn't their fault. And that's the point in time when our nation and our state steps up. That's why I am an advocate wholeheartedly to either go big or go home. Because we have, again, undersized. How many times are we going to have to do this stimulus thing in order to get us over the top of the mountain? Now, sure, somebody somewhere is going to game the system. And sure, somebody somewhere is going to end up with something that maybe is too much or we shouldn't have given them. You know, but at the end of the day, we'll never make it perfect. We'll never make it perfect. I am absolutely in favor of going big and absolutely assuring that we help all those that are out there that are hurting to the best of our abilities, whether they be individuals or businesses, and we get America really cooking again. Now, you'd have to say just this, and let's be fair. Let's be fair. We have a new president. We want to be respectful and support him in every way, and absolutely that's exactly what I'll do. But at the same time, it would be absolutely wrong to not step back and think about what President Trump brought to the table. This hit him just boom, right in the cold. Absolutely, we didn't have enough PPE, did we? We didn't have masks. We didn't have gowns. We didn't have all that, did we? And he scrambled beyond belief, and his great people and himself did things that were unbelievable, plus the fact that they put us on a pathway and they got us a vaccine in 9 months or whatever. Unbelievable. Unbelievable. Today in West Virginia, I'm reporting to you we have had 6 deaths. I am reporting to you that our death rate in the last 6 weeks has dropped 70-some%. Somebody needs to stand up and say, thank you, President Trump, because he brought us and he gave us that opportunity. Now, did I condone everything President Trump said and did? No. Would I condone everything that President Biden would say and do? No. But I would stand as an American respectful of that office and thankful for all the great work that they both have done and will continue to do for America. That's my answer.
All right, thank you, Junaid. Next question from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. There were reports out yesterday that this is the all-time record lowest flu season that's been recorded, and the experts obviously think that's because of the precautions people have been taking with COVID, wearing masks and social distancing. Has there been any thought given to in future flu seasons mandating mask wearing in public buildings?
Dr. Amjad, somebody needs to answer this, but from my standpoint, I hope to the good Lord above we get rid of these masks, as we go forward, but Phil, good question, good thought.
Sure. Phil, that is a good question, and you're right. We've seen not many flu cases this year, and we do believe it's also due to what you stated, people wearing masks, following good practices such as hand washing and social distancing. But as far as I'm aware, and also speaking with physician colleagues and listening to several updates that we have regularly, there has not been any thought to continuing wearing masks during flu season in and by itself, so to speak. But that is an interesting thought. I'm hoping people just have learned from this that washing hands is important, and covering your your nose and your mouth when you're sick and things like that. But I'm with everyone else. Hopefully we don't have to wear masks in the future. Thanks.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, just a thought, back on the last question that Phil asked and everything, we would always love for people to be more cautious and take more precautions, just as Dr. Amjad said, but I surely hope and pray that we do not have to mandate wearing masks, because I want us to be back to normal. I want us to be as close back to normal. I want us to be smart going forward, but I want us to be as close back to normal as we can be. The only notes that I made today, are I am happy that we're able to now, it looks like that our press is going to start getting their shots. That's really good. I am tickled to death that we only have 7 orange counties, and really I wish to God above that we didn't have any deaths, but 6 deaths in West Virginia compared to where we've been was an awfully great day for me. So remember those folks down in Buffalo Creek, and just remember all the people across this great state. We're doing great stuff in West Virginia, and thank you so much to all of you for pulling the rope, helping me pull the rope, all of us pulling the rope together. There's always going to be bumps and little bruises here and there, but for the most part, what a state. You have been unbelievable. And your numbers and what West Virginia, it could have been, being maybe the 3rd oldest and maybe the sickest and surrounded by border states and not an ocean, this could have been a disaster. And it has become the miracle the world just keeps talking about, don't they? Imagine, the other day, I was in front of you, and then boom, I've got to go on Fox, and trust me, I'm not calling Fox saying, will you let me be on, or CNN or MSNBC or whomever. They're calling West Virginia. They want to talk to us. They want to see what in the world we're doing. So, and in all that, one of the comments is, for crying out loud, we know you're leading the nation, but you're leading the whole world, West Virginia, and to me, it doesn't surprise me a bit. Now, y'all may think that I'm just blowing smoke, but if you know me, I don't do that to anybody. It doesn't surprise me one bit, West Virginia, just how great you're doing. It doesn't surprise me one bit, West Virginia, that the world is sitting back saying, dag, those people are unbelievable. What they're doing is unbelievable. I know you. I know how good you are. It doesn't surprise me a bit. We just had to turn you loose. Thanks a bunch, West Virginia. You've made us look awfully good to the world, and it'll pay big dividends as we go forward. God bless each and every one of you. Thank you.